Let's move on to the discussion. So today's question is, a 60-year-old gentleman presented with history of fever, recent onset of dementia. There is history of chronic diarrhea and arthritis. Biopsy showed the following. What is your diagnosis? Okay. So now let us summarize this question. There is history of fever. There is history of dementia, diarrhea and arthritis. So what are the systems involved? So you have involvement of CNS, you have dementia. So you have diarrhea, which is involvement of GIT. Then you have arthritis, which is involvement of joints. Okay. So you have involvement of CNS, GIT and joints. And the biopsy is showing, what does this biopsy show? So this is the mucosa small intestinal biopsy. All these are epithelial cells. This space is the lamina propria. So what you are seeing in the lamina propria is cells, plump cells with the nuclei. So these cells are nothing but macrophages. So this is a special stain which is PASD, and this is highlighting some organisms inside these macrophages. So both put together, when you have involvement of CNS, GIT, joints together with PASD, PAS positive and diastase resistant organisms, then there is only one diagnosis. So you have Whipples disease. Okay. So what is Whipples disease? So Whipples disease is caused by Tropherema whipple. So this is going to cause chronic diarrhea. Why? Because you have a lot of malabsorption syndromes which can cause diarrhea. But Whipples disease is one malabsorption disease which is going to be due to defect in your lymphatic transport. So your lymphatic transport is affected. Okay. So because of this, you have diarrhea. Then it can involve your CNS, GIT and your joints. And quatrimoxazole is the treatment of choice. And when you see these organisms, they are inside the macrophage. When you have it outside, it indicates activity. Okay. And these organisms, when you're going to do a PAS and PASD, what happens? So you should understand the concept behind doing a PAS and PASD stain. So why do we do a PAS, PASD? Suppose if you want to differentiate between a glycogen and mucin, we do both PAS and PASD. So what happens is, PAS stains both glycogen and mucin. But when you add diastase, that means we call PASD stain to a PAS stain, what happens? This glycogen will go off. So we tell PASD negative. That means they are sensitive to diastase. Whereas if it is mucin, they are resistant to the action of diastase. So they will be both PAS and PASD positive. So likewise, these organisms, they are diastase resistant. They are both PAS positive and PASD positive. Okay. So here, this is about the other option. What you are seeing here is lot of vacuoles in the epithelial cells. So this is seen in A-beta lipoproteinemia. So what is A-beta lipoproteinemia? It is absence of a beta lipoprotein. So that is involved in transfer of triglycerides. Because you don't have transfer of triglycerides, all these fat accumulates and causes vacuoles. So what's the special stain for fat? So you can highlight it by a oil red O. Okay. So apart from this intestinal manifestation in A-beta lipoproteinemia, your fat is very much essential for synthesis of cell membrane. So you have cells with spiculations. Okay. That also can be seen in A-beta lipoproteinemia. Then what is this? I told PAS positive diastase resistant organisms in intestine. Likewise, you can have PAS positive and diastase resistant globules in the liver biopsy, which is seen in alpha-1 antitrypsin deficiency. Thank you.